So there are signs of active infection. And let's start here. One of the classic signs that you have Lyme is that the symptoms come and go. They move around the body also. So there could be, for example, for a while you've got really bad headaches, then those go away and you feel good for a while. And then all of a sudden you're starting to have migrating pain, joint pains, your elbow, then it's your knee, so that's moving around. Different symptoms come and go. And this is because of the biology of the spirochete itself. It has a growth cycle that's based on about 4 weeks. So there'll be an active phase of the Borrelia where you can have a lot of symptoms. And by the way, it's during the active phase of the Borrelia that antibiotics are effective. If it's going into a more dormant phase, antibiotics won't work on it. And you'll feel better. You think, oh, I'm over this. There's a cycle to these that's pretty predictable of 4 weeks. So it's recommended that Lyme patients, and even if you suspect maybe you have this and it wasn't diagnosed, you keep an actual calendar that's marked off in the little squares to make it easy to look at. And you just record your good days and your bad days, maybe with color coding, a blue for good, red for bad. And then just jot down the main symptoms you're experiencing. And if you notice there is a dominant pattern that seems to be about 4 weeks long, that is one of the clinical signs that this is Lyme. So another one is low-grade fevers in the afternoon. Lyme tends to be more active in the afternoon. So notice if that's when you're just starting to feel worse. When it first comes on, it tends to mimic the flu. You'll feel achy, headachy, kind of feverish, exhausted. And then as far as the testing goes, there's blood testing that can be done where they test for C4A with normal C3A, and in the database it explains what that is. Then positive, of course, Borrelia direct tests, and that PCR, it's in the database. These are different types of tests to positively identify the Borrelia. So even if it didn't come through on the Western blot, you can do these other tests. The antigen is the Western blot type. A culture is the most specific kind where they actually take a tissue sample, for example, and culture it and find out exactly what kind of Borrelia you have, because the main one is Borrelia burgdorferi, and that's what they are looking for Lyme. However, there are about 100 species of Borrelia, and they're finding more of them all the time. Some seem to produce disease more than others, and some new ones have cropped up that are resulting in disease symptoms that are a little bit different. So here it explains a little bit about the Borrelia burgdorferi, and we go down here and read a little bit about what this one doctor, and I've kind of gone with the medical doctors who've done the most research and worked with the most patients successfully for what I have included in the database. This is an example of using a protocol, a natural protocol called the Byron White formula, which you can find in here.
I was actually taking some notes because I also have wanted to get a backup testing. And as I listened to you describe Lyme disease, just for the audience viewers, not very long ago, I was diagnosed with the Rocky Mountain fever. But as you're describing these symptoms, I'm wondering, too, if perhaps my diagnosis wasn't accurate.
Yeah, and that's quite possible. this is what's so frustrating to doctors and patients. So
Mhm.
I would suggest also that you spend some time in the database and read up on this, because I've made an effort here to help people kind of do some of their own diagnosis, working with the doctor. Hopefully you have an open-minded doctor that is willing to work with you, because, you know, this is tough for them too. Tell your doctor about the database.